Yeah, so there's quite a lot of exciting things. I think the biggest thing is we're learning about menin inhibitors, again, kind of a continuation of last ASH, but there are several abstracts. One is the top-line update of Augment 101 study with the Syndax compound, revumenib, which will be updated in the late-breaking session. So it shows still in a highly relapsed refractory population of MLL rearranged leukemias, the response rate is about 27% and duration response of about 6 months. So it's very similar to the initial phase 1/2 data, and this is a phase 2 dose of this agent. So we are hoping that this drug will be approved, FDA approved for the relapsed refractory AML. There are other menin inhibitors that are kind of trailing behind, and they will be presented at this meeting. There's a compound from J&J, which shows again very high, quite high response rate in relapsed refractory MLL and NPM1 mutated AML. And is quite safe, so it's moving forward also into combination trials. And then there's a compound from Sumitomo, which is again a little bit earlier in the development, but also shows a high response rate in the relapsed refractory setting. So I think these are like the biggest breakthrough for at least these two subsets of patients. I think additionally there are a lot of like what we call triplet combinations that will be updated at this ASH. So one is with FLT3 inhibitor Quizartinib. So the data presented from MD Anderson, combination of decitabine, Quizartinib, and venetoclax, both in salvage setting and newly diagnosed AML with FLT3 mutations that show high response rate and durability of response. There's also presentation again from MD Anderson group on combination with IDH inhibitors, IDH1 and IDH2, oral decitabine and venetoclax, which shows a very high, above 90% response rate with high levels of MRD negativity. So I think this will be quite exciting results. And I think final kind of my take is quite a bit of data on the minimal zero disease and FLT3 mutated AML on several studies. One is on the Morpho study, which was post-transplant maintenance study of gilteritinib versus best supportive care and the post-transplant FLT3 mutated AML that showed that the gilteritinib is effective only in patients who have MRD positive disease. So now the group led from Mark Lev is showing that the levels of MRD is highly predictive of overall survival